afternoon, everyone. I would like to welcome you to the 9th-month progress report on my PhD thesis, which focuses on assessing the efficacy and safety of proton pump inhibitors. My name is Elena. I'm a second-year trainee in gastroenterology and a PhD student here in the CTM and also at Grigore Popa University of Medicine and Pharmacy, Iași. And together with my team, my two supervisors, Balint Eroș and Vasile Liviu Drug, my SMS Mahmoud, and our statistician Dani, our vision would be to improve the clinical management of patients with gastroesophageal reflux disease, and we plan to do that by assessing the efficacy and safety of acid-suppressive medications. For this, we have two specific goals. First of all, we plan to assess the therapeutic effects of acid-suppressive medications in patients with non-specific chronic cough. And the second one is to look at the risk for Clostridioides difficile infection in patients with proton pump inhibitor treatment, both by conducting systematic reviews and meta-analyses. Allow me to talk in a bit more detail about our first project, which was started in September 2022. As we all know, the Montreal Consensus recognizes non-specific chronic cough as a potential extradigestive manifestation of gastroesophageal reflux disease. And this is a very important topic because chronic cough is estimated to have a relatively high global prevalence of up to 9.6% and to be a significant cause for quality of life impairment. For its treatment, acid-suppressive medications have been proposed as a potential therapeutic option. However, over the years, studies have yielded inconsistent results. In this context of the knowledge gap, we aim to investigate the efficacy of acid-suppressive medication in the treatment of non-specific chronic cough. For this, we used the PICO framework, where our population was adult patients with non-specific chronic cough, and the intervention was acid-suppressive medications compared to placebo. The main outcomes of interest were the impact on cough severity and quality of life, and we hypothesized that there was some benefit to acid-suppressive treatment in patients with non-specific chronic cough. We have performed our systematic search on the 1st of November 2022 using this search key, which is comprised of three main domains. The first domain is related to non-specific chronic cough, the second one to acid-suppressive medication, and the third one to the concept of randomization, as we only plan to include randomized controlled trials. As you can see here in our flowchart of selection, we ended up with 11 eligible articles. Allow me to talk a bit about one of our main results. This figure shows the mean change in cough severity in patients with non-specific chronic cough receiving proton pump inhibitors compared to placebo. Our measure of effect was the standardized mean difference, as all of these studies used various scales and questionnaires to measure cough severity. Just as a tip for the interpretation of our results, a standardized mean difference between 0.2 and 0.5 is considered a relatively small clinical effect. A standardized mean difference between 0.5 and 0.8 is considered a relatively moderate effect, whereas a standardized mean difference of more than 0.8 is considered a large effect. Here you can see our standardized mean difference was 0.33, so there's a relatively small but statistically significant clinical benefit to administering proton pump inhibitor in patients with non-specific chronic cough in reducing the cough severity. This data was derived from 9 randomized control double-blinded studies, totaling around 350 patients. You can see here that the population was rather homogeneous with a heterogeneity of only 16%. So to summarize this first result, we can say that there is some clinical benefit to administering proton pump inhibitors in reducing cough severity in patients with non-specific chronic cough. 4 of the studies we included had patients with chronic cough only, and 5 studies focused on patients with laryngopharyngeal reflux, which may manifest as chronic cough. For this, we have performed a subgroup analysis, and the analysis shows that there's no significant difference in symptomatic response between the two population categories. Additionally, we have performed a time dependency analysis, which aimed to investigate the relationship between symptomatic improvement and duration of acid-suppressive treatment with proton pump inhibitors. On the x-axis, you can see the duration of treatment in weeks, and on the y-axis, you can see the symptomatic improvement as represented by the standardized mean difference. And as you can see here, there's no marked symptomatic improvement with longer treatment duration. One of the main strengths of our first project is the fact that we investigated the effect of proton pump inhibitors on both cough severity and the quality of life, and we have provided additional insight by means of subgroup analysis and time dependency analysis. Additionally, we have a very homogeneous included study design, as we only included randomized controlled trials, and of course we followed a very rigorous methodological approach. There are a few limitations as well. One of the main ones is the fact that there's a relatively small number of included patients and that all measurements of the outcomes were subjective using various scales and questionnaires, not all of which were validated. As our two main conclusions, we can say that treatment with proton pump inhibitors seems to result in some modest symptomatic improvement in patients with non-specific chronic cough, and that this effect does not seem to be dependent on the duration of administration. Therefore, in clinical practice, we could say that there could be some benefit in selected patients, and there seems to be no benefit from extended treatment durations. In terms of implications for future research, we suggest that further RCTs be conducted with appropriate sample sizes and maybe with the employment of objective cough measurement techniques and maybe the investigation of additional acid suppressors such as the newer potassium competitive acid blockers. As we all know, proton pump inhibitors are among the most frequently prescribed medications worldwide, with recent estimates from Spain saying that 1 in 10 people is actually a daily PPI user. An increased risk of Clostridioides difficile infection has been described in PPI users with an up to 2-fold higher risk compared to non-users. However, we should keep in mind the fact that these results are only derived from observational data, and these could be the result of confounding and other biases. Therefore, our aim would be to investigate this risk of Clostridioides difficile infection in patients receiving proton pump inhibitor treatment in the context of randomized controlled trials. For this, we also employed the PICO framework when our population is adult patients. The main outcome of interest, the main intervention of interest is the proton pump inhibitor treatment compared to no proton pump inhibitor treatment, and the outcome of interest would be the Clostridioides difficile infection rates. This way, we aim to investigate the safety profile of a proton pump inhibitor treatment. We have performed our systematic search on the 2nd of March 2023 using this search key comprised of two main domains. The first one related to proton pump inhibitors, and the second one to the concept of randomization. As previously mentioned, we are only included randomized controlled trials. We are currently at the stage of full text assessment, which is in progress. As a quick summary, the first project has been submitted for the first time in May 2023 and will be resubmitted this week. And the second project is estimated to be ready for submission somewhere around September 2023. I would like to thank you for your attention and leave you with a quote from Franklin D. Roosevelt, which says that a smooth sea never made a skilled sailor. Thank you.
I would like to ask what was the range of length of treatment considering all the studies included in your investigation?
Can you repeat
the
that?
length of treatments.
The length of treatment,
yes.
Okay. For the second project or the?
For the first one.
For the first one, okay. So it usually, most of the study had a treatment duration of 8 to 12 weeks. So most of them assessed 8 to 12 weeks. We have studies who also assess mid-treatment, like at 4 or 6 weeks. That's why we could do this time dependency analysis. The maximum treatment duration in most of the studies was either 8 or 12 weeks.
It's kind of related to the previous question. Do you plan to assess for how long they were using PPI? Because as I know, there are some studies where they just give one-time PPI, and most probably that will not yield a significant result.
Okay, thank you for your question. In the current state of the full text assessment, of course, we're looking at treatment duration. We don't have a criteria for including or excluding studies based on treatment duration. We're going to include all the studies that give PPI and report the C. diff rates. And then we're going to do subgroup analysis or look at how the treatment duration may influence the rates of C. diff. As related to studies that give one-time PPIs, I don't think we're going to be able to actually find studies that looked at that just by one-time administration. So I'm assuming that's not going to be an issue. But for the rest, we're going to include it irrespective of treatment duration, and then we're going to analyze differently based on duration categories.
Did you investigate, or is it possible to investigate the lowest effective dosage of acid-suppressive drugs in chronic cough?
Thank you. These studies actually use similar doses, so I don't think it's possible to look at the lowest effective dose. To see, most of them use omeprazole, 40 milligrams twice daily. That's, I think, the most common medication used in the studies that we included. Other than that, it's just one of them uses once daily administration, all the others have twice daily, so I don't think the actual dosage difference is that significant between the studies.